They document this. When a home wellness visit happens, it's not just a friendly check-in. Information is being recorded, even when it feels casual. Many people assume these visits are only about basic health questions. But what's documented often goes beyond what you expect. And understanding this matters, not because it's dangerous, but because awareness gives you control. This is part 2 of a 5-part series. If you found this helpful, please like and subscribe so you'll be notified when the next parts are released. A home wellness visit is designed to create a complete picture of health risk. Not just your symptoms. Not just your medications. But the environment you live in every day. During these visits, a healthcare professional may ask questions about sleep, energy levels, breathing, mobility, or daily routines. That feels normal. What's less obvious is how context matters. Your answers don't exist in isolation. They're interpreted alongside what's observed. Things like how easily you move around your space. Whether you mention feeling tired or distracted at home. If you describe trouble sleeping, frequent headaches, or lingering discomfort. Even the way a home is described, cluttered, quiet, noisy, damp, warm, or poorly ventilated, helps form a broader health profile. This isn't about judging anyone's home. It's about risk classification. Health systems and insurers work with population-level data. They're looking for patterns that predict future care needs. Environmental factors matter because they often explain why certain conditions develop or worsen over time. Poor indoor air quality is linked to respiratory issues, fatigue, and concentration problems. Chronic noise exposure affects sleep and stress levels. Inconsistent lighting can disrupt circadian rhythm. Excess moisture increases the likelihood of mold-related symptoms. A home wellness visit helps document whether those risk factors may exist. Often, this documentation isn't visual inspection. No one is testing your walls or measuring humidity. It's indirect. Your experience becomes the data. How you feel at home. What you struggle with daily. What you describe as normal. That information is then combined with existing medical records to update a broader health profile. This is why these visits are sometimes incentivized. They're valuable for understanding long-term risk, not just current illness. And to be clear, this isn't automatically negative. Early documentation can help identify needs that might otherwise be missed. Mobility support. Sleep concerns. Respiratory symptoms. Medication adherence issues. The key is understanding what's being captured. Because when you understand the system, you can engage with it intentionally. You can answer questions accurately without oversharing assumptions. You can describe symptoms clearly without minimizing or exaggerating. And you can recognize that your environment plays a role in how your health is perceived. This also explains why home wellness visits often feel different from office appointments. In a clinic, the focus is the body. At home, the context matters. Your living environment becomes part of the health conversation. That's why many people feel uneasy, not because something is wrong, but because it's unfamiliar. And unfamiliar systems often feel intrusive when they aren't explained. The important takeaway is this: a home wellness visit documents patterns. Not perfection. Not fault. Patterns. How you live. How you function. How your environment supports or strains your health. When you understand that, the visit becomes less mysterious. and you're better equipped to decide how you participate. In the next video in this series, we'll explore something closely related: the quiet trade-off between convenience and control in home health visits, and why that balance matters more than most people realize. If this video helped you understand what's really being documented, consider subscribing so you don't miss the next part of the series. Wellness begins at home, and clarity begins with understanding. See you in the next video.